Jay Martins and the call that one Fine Fine Love, an amazing throwback song that we've been enjoying back in the day and still enjoying right now. Still your number one Fun Health Radio, watch 94.9 FM. Time check, 15 minutes past the hour of 3 p.m. And like I mentioned earlier, today is the International Day for Zero Tolerance for Female Genital Mutilation, and we are marking today, celebrating today with an amazing guest right here in the studio with me. She is a medical person and she will be talking to us about female genital mutilation. Dr. Tᴜɪᴛᴛᴇʀ, she's the President, Medical Women's Association of Nigeria, Lagos State Branch. Good afternoon, ma'am.
Good afternoon.
How are you doing this beautiful afternoon?
Very well.
We are glad to have you here at Watch 94.9 FM to talk to us about female genital mutilation. To start this afternoon, can you first just tell us a bit about female genital mutilation? Explain in layman tongue and its different types.
Okay, thank you for having me. I'm glad to be here. Good afternoon, viewers.
Yes.
Today is the International Day for Zero Tolerance against female genital mutilation. Female genital mutilation, or cutting, as some people will put it, it's a series of procedures that involves partial or total removal of the female external genitalia. In other words, the female reproductive organs, for the female, what we know as the vagina, their reproductive parts, it has different parts to it. It has the part we call the clitoris. It has what we call the labia minora and the labia majora. So in female genital mutilation, either a part or more of these female external genital organs are removed. Parts are removed. They remove it for non-medical reasons. So that's what makes it mutilation. It's removed for non-medical reasons. Most of the reasons are purely cultural and some born out of myths. So there are different stages or types, ranging from type 1, 2, and 3. Type 1, it's when the clitoris is moved. The clitoris, I wish I had a diagram of the external organ here. But there is that tip of the female external organ that's called the clitoris. So in type 1 FGM is the abbreviation for female genital mutilation, that clitoris is cut off. And that's type 1. In type 2, both the clitoris and the labia minora, the broader part on which the clitoris rests, is also removed. And then they have the third part, which the labia majora, as the bigger part of the labia, is also removed. You can picture it. It's I don't want to use the word terrible, but it's an unfair thing to do to a girl. So usually, for cultural reasons, this is done on girls. It's common in Africa, Asia, and some parts of Latin America. That's why it's common. And about 200 million girls annually. And we can break that down to about 12,000 cases per year. As a matter of fact, the prevalence compared to what it was 3 decades ago has come down. Where we want to say, well, that's some good achievement, but we are not there yet. It has taken a lot of efforts to get to this stage, but I think more work needs to be done to curtail this act. It's unfair, and it's an abuse of the human rights of the girl for that to be done.
The plenty the medical jargons that have been used here today. In my head, I'm already picturing it. The diagram and our bodies, the clitoris, the minora, the majora. But I wanted to confirm it is what we call the circumcision, right, ma?
Well, yes. To a certain extent, when the clitoris is removed, then in some parlance it says female circumcision. But what we know in biblical times, and I think in the Islamic parlance as well, who are to be circumcised when the foreskin is removed. Now the clitoris in the female is like the foreskin, the equivalent of the foreskin in the male. So when that is removed, at the back of the minds of those who do this, who carry out this practice, they are doing female circumcision.
Wow, I hope you are learning a lot myself. What are the cultural and social reasons behind the FGM, that's the female genital mutilation, and how can we address these underlying factors, especially in our society today?
Okay, so one factor that is very predominant culturally is they feel when the males are circumcised, they say they have become a man. The boy is circumcised, they have become a man. So in some cultures, they believe when a woman is circumcised, she has become a woman. Quote now. And then some believe that if that is not done, she may become sexually promiscuous. Some believe she will not enjoy sexual intercourse. Some think she may not have children. It's going to affect her conception and all that. So these are some of the beliefs, and I think they are myths. And there's some, in some extreme cases, they believe that if the female is not circumcised, in quote now, her husband will not enjoy her, her husband may get infection, and things like that. They are all myths.
Wow. The funny thing is that another one that we're hearing, or we've been, experiencing or understanding these days, is that when this female genital mutilation is done, the woman does not enjoy sex. Now, they think back in the day that when you do not do it, that is when she will not enjoy sex. But the idea right now that we understand now is that when they do it, that's when they do not enjoy sex. But can you please explain better?
Yes, because it causes, it has complications. For ease of understanding and for the purpose of our conversation, I will divide the complications into short-term complications
and long-term.
The short-term is the ones that will come immediately or not too long after the procedure is done. One is that of pain. You can imagine a sharp object on the so there's pain. Some of them go into shock. Some of them may bleed. There's no telling who will bleed excessively or exposed to injuries. There are bleeding issues in some people that is hereditary, that they do not know of. And then when such people have injuries, their blood does not stop quickly until something is done. You cannot imagine such a person undergoing FGM. She's going to bleed to death. So bleeding is a complication. And then infection. In those days when they do these practices, they probably do not use sterile instruments. Okay, they just use knife fight. You see a situation where they use the same sharp object, either razor blade or knife, on several girls. In some climes, we know that they bring the girls together. It's a ceremony. It's a ceremony. I think in some parts of Kogi State and Ekiti, if I'm not mistaken, there's a ceremony that is done. And all those maidens between age 12 or thereabout are all brought together. And then the chief female priest now does that procedure on all of them with the same instrument. So you can imagine transmitting infection, various types of infection from one to the other. And then when that area is not well taken care of soon after the procedure, they are exposed to further infections as well. So, and these infections, when not taken care of, now affect them on the long run. When eventually they grow to become women, they get pregnant, they get married, and then they have infections, problems with conception, problems with sexual intercourse. That pain now continues. That's what we call dyspareunia, pain during sexual intercourse. There are different things that can cause that though, but this is one of it as well. So infection is a problem with some of them. And then some of them begin to have difficulty in passing urine. The female genital organs, our vulva, that's the area where the vagina is close to the urethra, where we pass urine from. So in the process of the circumcision, quote now, the mutilation, at times the area of the bladder is eroded, and then they have pain when they are passing urine. So there's so much confusion that then, of course, there is the mental mental health part of it. Some of these young girls, they never recover from the shock of the procedure, and they go about feeling inadequate, insecure, not wanting to expose themselves, not knowing whether other girls have gone through what they have gone through at all, not wanting to talk about it. So they lapse into depression, they internalize, and they don't mingle freely. So there is the mental health component as a complication of this procedure.
So we have both the mental health, we have both the physical one as well, the bleeding, the infection, and also the mental health situation, and also even the long-term sexual intercourse situation when you're married and you now want to start having children is another problem as well. But you mentioned that when they do it, the children get into shock. But I also made the research has shown that they do it between 2 years, when the child is about 2 years. Can you explain that? How can a 2-year-old child run into shock and begin to experience all of that? Because I believe that from that age, before you know it, the child forgets about it.
Oh, they don't be surprised that a 2-year-old can recall certain things.
Okay.
The way the cognitive part of us, the way God has made us. But that aside, the shock can be in 2 ways. The shock resulting from excessive bleeding, and then shock as a result of the mental trauma that they've passed through. So if they begin to play back the scenario, they go into hysteria. Okay. So that can happen. And then it is not in all climes that they do it at that age.
Okay.
Some of them, the girls are older. I just told you about some areas where they make a ceremony out of it. So the girls are actually older. When they do that in some places.
Exactly. I think that was exactly the part I was trying to get out. The older one. Wow, this is quite serious.
Now, permit me to also add that one complication that sets in when the woman becomes a woman of childbearing age is what we call postpartum hemorrhage. She manages to get pregnant, and then she delivers, and then she starts bleeding. Bleeding is a concern to us in the medical field, especially to us in Medical Women Association of Nigeria. We are on a campaign to put an end to PPH. PPH is postpartum hemorrhage, bleeding resulting after delivery. At times it has happened, it could be during the delivery, but most importantly, after delivery, it's a serious cause for concern. No woman should die of PPH. It's not right. No woman should die of PPH. And now PPH resulting from a lot of causes, and the one we are talking about today, FGM, is just not right. It's unacceptable, and that is why the international community is saying there is zero tolerance to FGM, zero tolerance to PPH. If we do not tolerate FGM, then PPH, if we do not tolerate FGM, PPH resulting from
FGM
will be, well, at least that will be out of it.
Out of the way.
Other causes
to come back. We'll take this particular question before we go on another break, on a short break, and then when we come back, we'll begin to take all of this in. Can you just give us a balance? How can we balance cultural sensitivity with the need to protect women and girls from this harm? Because it's a lot.
Yes. One way to do is to understand ourselves. There has to be education, there has to be awareness. And I'm glad WŽ FM is doing this. You're a station that thinks health and that talks health, and it's good. So one of these is to raise awareness that some of these are cultural practices. We need to understand what we are doing, where we are coming from, where we are going. Cultural practices that are harmful should not be encouraged. They should be dropped. There's civilization now. We now know better. In those days, they would write with feathers and ink on scrolls. Now we write on paper with pen and things like that. And all that. In those other days, too, when we were in primary school, we would write on the blackboard with white chalk. Now we use whiteboard and whiteboard markers and all those things. So life has evolved and there are changes, positive changes. So we should embrace the positive changes and drop those cultural practices that are harmful. FGM is a harmful cultural practice that impinges on the right of the girl child. The girl does not have a choice. If the girl had a choice and that procedure is explained to her, she can say, yes, I want it. No, I do not want it. So it's an encroachment and impingement on the right of the girl, on her safety, on her right to life. So it should be
stopped. Your Dr. Ige, is an encroachment to the right of the girl child, and that harm should be stopped at all costs. We'll be going on this short break, and then when we come back, we'll be rounding it up on this amazing talk with Dr. Ige. Stick around. Of Nigeria, Lagos State branch, and we're still talking about female genital mutilation. She's been speaking a lot, and I have been learning a lot. I'm very sure you have been learning as well. This is the last segment of our talk on the show today, but we are about to go into the prevention and eradication of female genital mutilation. Let's see if somehow we're able to find a way to eradicate this. So, welcome back again, Ma. All right. So, I wanted to find out, are there ways where healthcare providers, communities, government workers, government generally can work together to end the female genital mutilation?
Oh, certainly, yes, there are.
Okay, ma'am.
One of such is health sensitization and awareness, such as we are doing now. So let me say kudos to ᴏᴜᴜ.
Thank you. Thank you,
Right.
Ma.
So that's one. And another is sexual education. We need to educate our girls. We need to educate our women about sex and sexual education. What they should know about themselves, about their sexuality, about their reproductive organs, and about the act of sex, so that it's done the proper way. That's yet another. Then we must promote programs that will promote gender equality. Yes. Yes.
Ma.
The girl child has a right.
Ma, you see this gender equality that you called now. It's on the table. The table is shaking with one leg.
No, certainly it is not. We need to understand what we mean.
Okay,
what we mean. Everybody has a right.
Okay,
The
ma.
girl child has a right. She has a right to exercise her power, to exercise her choice. She has a right to say no. A right to life. Everybody does have a right to life. So, if she also has a right to enjoy her full rights. She has a right, but she has a right to enjoy that right. Okay, so these are some of the things we can do to stem the tide of FGM and actually eliminate it. That's where we are going. The plan of the international health community is that by 2030, FGM will be nowhere.
Okay.
So the encouraging thing is that, like I said before, the prevalence that we have now has declined compared to what it used to be 3 decades ago. So we are winning the battle little by little, but we can do more. And that is why the theme of the celebration, the commemoration this year is step up the pace. We need to step up the pace at which we are giving this campaign and enlightenment and encouraging people to drop these harmful practices and discouraging continuity. Yes. So we need to step up the pace so that we're able to cover much more grounds than we have covered in the last 3 decades. I said before, where we are now is such that 12,000 girls are suffering or being exposed to FGM per day.
12,000 girls per day.
Yes, worldwide. So if we step up the pace of our campaigns, concerted efforts with strategic plans and implementations, if we do that, then we'll be able to cover more grounds, and probably by 2030, we won't just have any.
At all.
That's the plan. So there must be coordinated and systemic effort on the part of government, on the part of policy makers and healthcare providers to ensure that FGM becomes a thing
of the past.
We can now say, oh, those days they used to, but now not anymore. That's where we are going.
Hopefully we get there by 2030. But I wanted to draw your attention to the fact that we still have our mothers in the village, because I feel like this whole mutilation came from them. Their mothers and their mothers. And we still have them in the village that believe 100% about female genital mutilation. How do we get to them?
So education has to be taken to them. This campaign that we are doing has to get to them. So we need indigenous
teachers,
indigenous campaigners, indigenous media. Like your station now, we need stations that have reach, that will get to those hinterlands, those places where these grandmas
yes, ma'am.
So if we get there, they listen to radios, listen to campaign. That's why I say there has to be coordinated. Maybe I should add deliberate. Deliberate and coordinated systemic strategies in place. So part of it will be to deliberately carry the campaign to those villages and clans where they are and educate them and let them know about it. Now, in many communities, they bring their children for immunization. They now know what immunization means and the benefits. So the strategies we use to achieve that, we can also apply it here and be deliberate about it and coordinated about it. So it's not something that should be done haphazardly. And then when you let them know the implications, the PHB on the floor. Nobody wants to lose their loved ones. So we let them know these complications and what it means to them. Some of them will
so let's talk about support and resources for those people that have undergone it at the female genital mutilation. What support services are available for individuals, people who have undergone this female genital mutilation?
Yes, the support. The trauma of what they have passed through.
Yes, ma'am.
So the support system has to cut across, starting from the family. When the other members of the family, let them know that they are loved, they still belong to the family, they understand them, they can identify with them. Their spouses must also show understanding, particularly family members show understanding. And then government has put in place some groups and organizations that have programs for them to make them know that they are not less women because they had passed through this. And they can navigate and come out of the trauma and live life normally. So these are some of the support systems the government has in place, and we want to encourage them to leverage leverage them and take advantage and come out so that they can be healed and they can live and enjoy life to the fullest.
Thank you so much, Ma. Just this last question before eventually I ask for your last word for those that are undergoing it presently as we speak, because I'm very sure that people that are undergoing it presently as we speak, are there any resources or organizations that provide assistance or advocacy for those affected by this genital mutilation? Maybe non-governmental organizations. Do you know of any that you can speak of?
Well, I cannot readily think of any, but I do know that the United Nations is on the front burner, and that is why we have an International Day crying against it. All right, so the United Nations is on the front burner. The Lagos State government has zero tolerance for these practices as well, and so the State Ministry of Women Affairs and Poverty Alleviation, on top of their game, they are a body that can be reached out to, because they are involved and coordinate a lot of things that have to do with the well-being of women, as their name implies. So it's also an organization that is into that. Many NGOs who are women-focused also have I don't use the word sympathy, have empathy
Okay,
for
ma'am.
women in this category, and they can be reached out to as well.
All right, Ma. This is what we call it a wrap. But before we call it a wrap, Ma, just your final words for people that are currently struggling with this female genital mutilation as we speak. What are your final words for them?
Okay, just to say to them, there's light at the end of the tunnel, and it's not the end of the world. You can come out well, you can come out unscathed. You should reach out, call for help, and embrace life. They have a right to speak out. That's why we are speaking out now.
Absolutely.
Speaking against it. So they have a right to speak out, they have a right to say no. They can stamp their foot and say, no, I don't have to go through this. My daughter doesn't have to go through this. My sister doesn't have to go through this. My niece doesn't have to go through this. My friend, my girlfriend doesn't have to go through this. So they must speak out.
All right, you heard Dr. Ige. She said, you must speak out. You have the right. Like she mentioned, she mentioned equal rights. All right. She said, we have the right to have our rights as females. So you must be able to speak out if you are caught in the web of this situation, female genital mutilation. Reach out to the right quarters. Reach out to the right offices, and the desired help that you need, you will definitely get. Thank you for staying with us on the show today. We remain watch 94.9 FM. Time check, 49 minutes past the hour of 3 p.m. Stick around.